Okay, so good evening to you, good morning, good afternoon again, wherever you are listening to this in any part of the world and whatever time it is. I hope I got you covered in there. Okay, good night. Good night. That was the one I did not add. I promised bringing you another video on the book that is about to be launched on the 22nd of this very month of August, and that is just some few days away. It's going to be Saturday, exactly next week, Saturday. This book is going to be launched, and I did give you a teaser, and I promised to bringing you another much more detailed review of the book. Of course, I'm not going to give you everything in the book, otherwise you're not going to buy the book, you see. So just a teaser of the review that I did, and I think this is a book that you have to get one. I don't know why you would not get this. To start with, Sylvanus Gatorwu is my name, and I'm a health journalist, and I'm happy to be talking about this book because it was such an honor to be the one to review this book, which was published on the Ghana Business News. The review was edited by Mr. Emmanuel Dogbevi, a respected and renowned journalist with over 30 years of journalism experience and counting. So I'm honored to have worked with him and to have him edit this work. So straight up into the review. The book is entitled How to Prevent Kidney Disease. How to Prevent Kidney Disease, and the author is Dr. Elliot Koranteng Tannor. And so you want to keep those details if you go to the market to look for this book. Now, in my review, the first thing I captured is some little statistics about kidney disease and the price, or how much it costs for people to actually go through what is called dialysis. That is what is done when your kidneys are no more functioning, and a hospital equipment is supposed to be used to get out toxins out of your blood or out of your system. Okay, I'm not a medical doctor, so I'm trying to make this as simple as I can. Now, that process is what is called dialysis. According to Dr. Akosua Ampoma Esumaning of the renal unit of the Komfo Teaching Hospital, most patients on dialysis who have to go through this process due to kidney failure are under 40 years of age, and that is very, very serious. It means that the young people are not taking good care of themselves as they ought to. And if you are young, I think you ought to be cautious of your health. What is more, they need approximately 325,000 Ghana cedis to attend one session of dialysis. What is happening is that if you are supposed to be on the dialysis machine, you will go through this process like 3 times in a week. So you multiply that by 3 and you are going to have 975 Ghana cedis every week to keep surviving. And it is very, very difficult for the average Ghanaian to organize this kind of money. You are talking about 3,900 Ghana cedis every month. And very few people can afford this kind of money every month. And so it is important for you to prevent yourself from having any problem with your kidneys. Trust me, it is so important, which is why I've taken the time to review this book so that you would see the need to go purchase one. Now, to start with, this book is divided into 3 different segments. So Dr. Tannor has made the book very simple. It is only 85 pages. Yes, only 85 pages. Doc is a nephrologist, somebody or a medical doctor who has specialized in issues relating to the kidneys. That is who we call a nephrologist. And He's made this very, very simple. Knowledge acquired over several years of work experience, all packed up in just 85 pages. Let me summarize the book for you. The book has just 3 things everyone must know about their kidney. That is number 1. Number 2, the essential functions of the kidney. And then number 3, how to prevent kidney disease. That's it. So the first part of the book talks about things that everyone has to know about the kidneys. He explains what the kidney is and what it does. So you get to know all that. In the second part of the book, he talks about the functions of the kidneys, exactly what are the kidneys doing in your body. And he takes time to explain certain myths that we've all had about kidneys. I don't know if you've ever heard this, but some people, I heard this growing up, that everyone has 2 kidneys and only one works at a time, so the other one is reserved. Well, get to read the book and you get to know that a lot of these things that we were hearing growing up are myths. They aren't the medical realities. So you get to know the reality when you read the book. I've read it. Don't ask me about it. Go get a copy. All right. And it's so simple that a student at the junior high school level can read to understand. So again, the first part is actually in just 3 chapters. It explains in very simple English what the kidney is. And then he also delves deep and deep into the kidney disease in very simple everyday English. So you read it and it will knock off all the myths that you have heard about the kidneys. Now, the second part of the book is made up of 6 unique chapters, and it is on the functions of the kidney, as I've already said. He gets into the details of the actual work of kidneys, what they're doing in your body, and then he breaks down very complex medical terminologies into simple, comprehensible English language which you would understand. He talks about did you ever hear what is urine therapy? It got people drinking their wee-wee here in Ghana. I don't know about other countries, but I saw this happening in the early 2000s, 2001, 2002, 2003. I saw people reading a lot of material on urine therapy. Now, doctor addresses some of these issues because you read a book and you get to know that the work of the kidneys are to get everything toxic out of your body, okay, through the liquid that you pass out called urine. Now, if you are drinking this back into your body, you are actually not doing yourself any good. So he gives all these little bits and pieces of advice and caution in the book. So please go get a copy. This is the second part of the book, and it is in 6 chapters. The whole book is 85 pages, so it means it's not too lengthy. Now, the third part of the book talks about things that you have to do to prevent kidney disease. He lists them from A to K. So you have A, B, C, D, all the way to K. And he begins with something very simple as controlling your sugar intake. Controlling your sugar intake. Again, controlling your sugar intake. And then it follows B, C, D. Don't ask me about them. Just go get a book. But the last one is know your family's medical history. Personally, growing up, I really never took this serious until I enrolled into the clinical pastoral education where you are trained to be a chaplain. And I was taught how to construct a genogram. And then I got to know the importance of tracing your family history. And one of the importance of it is actually medical. You get to know if there's a family history of kidney disease in your family, and it will help you take very good care of yourself. Okay, so go get a copy. The icing on the cake of this all important book is a glossary of 15 keywords that you are likely to hear when discussing kidney related issues. So doctor takes time to explain all these words one by one. And for the curious minds who want to know more, the book has 13 other references and suggested readings. If you want to read more, you want to understand more, maybe you just want to know more than just the average person on the street, or you actually dreaming of pursuing a career in medicine and one day become a nephrologist. Well, these 13 references will be good for you, as they will help you acquire more knowledge. Not enough for you to be a medical doctor, of course. You have to go to the medical school and then go through again and progress to become a doctor, okay? But it's just going to satisfy your curiosity for now, for you to get to know more. So this is my review in some few minutes, less than 20 minutes. I want to encourage you to go get a copy of this book to read. Read it over and over and over again. Don't just buy a copy for yourself. Buy one for a friend, and let us keep ourselves healthy. Don't forget to like, comment, and of course, share. And if you haven't subscribed to my channel, please do subscribe. This is where you get to hear all the interviews that are conducted for the GhanaHealthNews.com. Goodbye.